Diabetes is a chronic condition that affects the way our bodies process glucose, a sugar used for energy. It occurs when the pancreas does not produce enough insulin. Insulin is a hormone that regulates blood sugar levels. Common types of diabetes are type 1, type 2, and gestational diabetes. Type 1 diabetes usually develops in childhood or adolescence when the immune system mistakenly destroys the insulin producing cells in the pancreas. People with type 1 diabetes require lifelong insulin therapy. Type 2 diabetes is more common and typically develops in adulthood. It occurs when the body becomes resistant to insulin or pancreas does not produce enough insulin. Lifestyle factors, genetic, and obesity play a significant role in its development. Gestational diabetes occurs during pregnancy and affects women who did not have diabetes before becoming pregnant. Hormonal changes during pregnancy can make it difficult for the body to use insulin effectively, resulting in high blood sugar levels. Gestational diabetes usually resolves after giving birth, but it increases the risk of developing type 2 diabetes later in life. Managing blood sugar levels, balanced diet, and physical activities during pregnancies are crucial to ensure the health of both mother and the baby. Complications of type 1 diabetes are hypoglycemia, cardiovascular disease, diabetes ketoacidosis, kidney disease, and eye complications. Complications in type 2 diabetes are usually eye problems, foot problem, heart attack, stroke, nerve damage, mouth and gum disease, sexual problems in men's and women's, hypoglycemia or hyperglycemia, diabetes ketoacidosis, hypersomnolent hyperglycemic state. Gestational diabetes occurs during pregnancy and characterized by high blood sugar level that develops are recognized during pregnancy. Possible complications from gestational diabetes include having a large baby, premature birth, hypoglycemia, and preeclampsia. Gestational diabetes also increases the risk of developing type 2 diabetes in mother and baby later in their life. Common signs and symptoms of type 1 diabetes are excessive urination, increased thirst, unexplained weight loss, extreme hunger, fatigue and lethargic, blurred vision, persistent infections such as thrush, UTI, kidney disease, PCOS, depression, and high cholesterol. Signs and symptoms of type 2 diabetes are frequent urination, increased thirst, always feeling hungry, feeling tired, blurred vision, infection, tingling and numbness in hand and feet, weight loss or weight gain, slow healing of cuts and wounds. Signs and symptoms in gestational diabetes are increased thirst, frequent urination, nausea, fatigue, sugar in urine, frequent bladder and skin infection, yeast infection, blurred vision, and dry mouth. Pathophysiology and etiology of diabetes mellitus are based on the body's ability to use insulin, the level of insulin in the body, and the insulin resistance. Type 1 diabetes is an autoimmune disorder characterized by the destruction of insulin-producing beta cells in the pancreas. The exact cause of type 1 diabetes is not fully understood, but it is believed to involve a combination of genetic predisposition and environmental triggers such as viral infection. The immune system mistakenly identifies the beta cells as a foreign and launch an attack leading to their destruction. This results in a little to no insulin production, leading to increased blood glucose level in the body. People with type 1 diabetes depends on insulin every day of their lives to replace the insulin the body cannot produce. They must monitor their blood glucose level throughout the day to ensure they stay within their target glucose range. In type 2 diabetes, the body either produces inadequate amount of insulin to meet the demands of the body or insulin resistance has been developed. Insulin resistance refers to when cells of the body such as muscles, a liver and fat cells fail to respond to insulin even when levels are high. In fat cell, triglycerides are instead broken down to produce free fatty acid for energy. Muscle cells are deprived of an energy source and liver cells fail to build up glycogen stores. This is a metabolic disorder that arises from the combination of insulin resistance and impaired insulin secretion. Insulin resistance occurs when cells become less responsive to the effect of insulin, requiring the pancreas to produce more insulin to maintain normal glucose level. Over the time, the pancreas may struggle to keep up with the increased demand, leading to insufficient insulin secretion. Genetic predisposition, sedentary lifestyle, obesity, and old age are the risk factor of type 2 diabetes. Gestational diabetes is a serious pregnancy complication in which women without previously diagnosed diabetes develop a chronic hyperglycemia during gestation. In most cases, this hyperglycemia is the result of impaired glucose tolerance due to pancreatic beta cells dysfunction on the background of chronic insulin resistance. The exact cause of gestation diabetes is not fully understood, but hormonal changes during pregnancy play significant roles. The placenta produces hormones that can impair the action of insulin in the mother's body, resulting in insulin resistance. The pancreas may not produce enough insulin, leading to high glucose levels and resulting in gestational diabetes. A sedentary lifestyle is one of the leading causes of obesity. Most obese people get diagnosed with diabetes, so it is helped to start an active lifestyle through sports and exercise. Currently, there is no known way to prevent or cure type 1 diabetes. However, research is ongoing to explore potential prevention strategies such as immunotherapy and early detection of autoantibodies. Type 2 diabetes is primarily influenced by lifestyle factors. We can prevent or delay the onset of type 2 diabetes by maintaining a healthy weight, adopt a balanced diet, engage in regular physical activities, make healthy lifestyle choices, and regular health checkups. Before women get pregnant, they may be able to prevent gestational diabetes by losing weight if they are overweight and getting regular physical activities. But do not try to lose weight if you are already pregnant. There are many ways to manage and treat diabetes, but the most important is to educate the patient and their loved one or caregivers at home regarding their diet and lifestyle changes. People with type 1 diabetes requires lifelong insulin therapy. Regular self-monitoring of blood glucose levels is essential. This helps in adjusting insulin doses, understanding pattern, and making appropriate lifestyle changes. Regular insulin injections or insulin pump therapy is required to control blood sugar levels. Following a balanced diet with a focus of carbohydrate counting, portion control, and consistent meal timing is crucial. Consultation with a registered dietitian or nutritionist is recommended. Regular exercise helps to maintain a healthy weight, improving insulin sensitivity, and managing blood sugar levels. It is important to balance exercise with insulin doses and monitor blood glucose levels before, during, and after physical activity. Diabetes self-management education program helps individuals to learn about diabetes, its management, and coping strategies. Lifestyle modifications are required to manage type 2 diabetes. This include healthy eating, weight management, regular physical activity, and stress management. Some individuals with type 2 diabetes may require oral medication or injectable medications such as insulin to help control glucose levels. With individuals when blood glucose levels are not well controlled, insulin therapy may be initiated. The type of insulin and doses are determined by the doctors. Regular monitoring of blood glucose levels help in assessing treatment efficiency and making adjustment as needed. Regular visits to the healthcare professionals are important for monitoring overall health, assessing complications, and adjusting treatment plans. Management strategies in gestational diabetes includes regular prenatal checks and close monitoring by healthcare professionals are crucial. This includes frequent blood glucose monitoring, regular checkups, and specialized consultation with endocrinologist and gynecologist. A balanced diet with controlled carbohydrate intake designed by a registered dietitian to meet a specific need of the mother and baby. Regular exercise or physical activities, as advised by the healthcare professionals, help maintain blood glucose levels within the target range. If blood glucose levels remain uncontrolled with the diet and exercise, insulin therapy may be prescribed. Insulin is considered safe to use during the pregnancy. After delivery, blood glucose levels are typically rechecked because it can resolve after delivery, but they have chances of developing type 2 diabetes later in their life.